Welcome to Don't Be a Meathead. Mark Thomas here with a man who has helped me tremendously, Vic Selvaggi. How's it going, man?
It's going well, Mark. Thanks for having me.
Yeah, well, I'm excited to have you on here because, like I said, you've helped me tremendously. I've watched you work with other people. You're one of the most renowned trainers in Maryland. I feel fortunate that I get some of your time. You got a great background, and I love what I've seen you do with kids.
Thank you.
Yeah, you've evolved over the years, right? Different styles of training. Can you tell us a little bit about your background?
Sure. I've been training since probably the early 90s, maybe a little before that. Working with, originally started working with PT, helping physical therapy patients move on through training, bridging the gap between PT and getting back to sport or to life. And it's just blossomed from there. I've done teaching in police academies, the fire departments, worked with countless amounts of athletes from all ages, from 6 years old all the way to, I think my oldest was almost 100 years old. So really have a diverse background. Kids especially have been interesting because I have a son, and watching him develop over the years has been fun. But children are and kids have been fun to work with because you really see the changes in how they grow on the field and also in the sport of life. So it's been quite a journey.
And there's different styles of training. I mean, we've talked about this before. There's your powerlifting, Olympic lifting,
Mhm.
and I know you still can work a variety of different stuff, but it seems like you've sort of evolved into what we call functional movement.
Yes. So it's really about goals. I mean, that's the first thing you walk in there. What are we trying to? Am I trying to be faster? Am I trying to be able to jump higher, be able to move better, be stronger, wherever it may be. So we use assessment tools like the FMS, and we start from a baseline of how they're moving. And from there, discovering if there's asymmetries based off of where there might be injuries or just compensations from other reasons, which can be countless, and then just correcting that with corrective strategies, working with good clinicians like Dr. Madison, and for the clinical side, and then putting them back into utilization, whether it's on the field or on the court, whatever it may be. And that's basically what we do, and it's been successful thus far.
So talk about getting faster, things like that, with high level athletes. You spend some time with athletes' performance, right? Which is one of the gold standards in this business. What was that experience like?
Yeah, it's called Exos now. That was 4 years. It was fun. The mentorship was great. I learned tremendous amounts out there. I mean, it was, to me, it was the hub of where everything started for me, and it wasn't just challenges we had to do and perform as well, but we also, the academics were there, and we had to really perform in the classroom as well. But I learned a lot from them, especially working one-on-one with athletes from all different levels, from professional football players to elementary school soccer players. I mean, it was just a great range of diverse kids to work with, and adults, and the amount of experience I gained for that is just tremendous. So it was highly recommended for any young trainers that want to get into this field.
Yeah, that's exciting. That's exciting. You mentioned Dr. Madison, Dr. Alan Madison, who's kind of how we both got connected to this project, right?
Mm-hmm.
And
Yes.
all of us that are involved with this are parents. So I think helping kids and helping other parents is something that we all really want to do.
Yes, totally agree with that. There's a lot of, I guess you want to say, misinformation out there. That's what parents are dealing with. When should my kids start weight training? Is it safe at this age, or what should I do for getting them to be able to run faster, or do they have problems with stability or balance? And it can be quite confusing because if you go to the internet, it's just full of information and most of it's wrong. So we've been using our techniques for years, and connecting with Alan years and years ago, we, through the FMS, we've basically knocked it down and got it down to a part where we're totally understanding the system. It's as no, let me rephrase that. If we stay in stick with the system that overall, over time, it just works. Now, from my standpoint, staying within my lane, if something needs to go through a clinician, then we pass them off. And then the integration from the clinician back to us onto the field, onto the court, wherever it may be, it just continually works. And that in itself is why we've been so successful thus far.
Mm-hmm. When you get kids as clients, I'm sure, the initial conversation is with the parents and you find out, what the goals are, but how do you decide what's appropriate for them?
It really depends on how they do with the testing. So it's, it might be something where they lack cardiovascular capabilities, or they lack strength, or they lack the ability to do plyometrics and jump and move, or they might have a standing asymmetry that they might have known about from maybe an injury 2 or 3 seasons ago. So it really depends on what they give us with the screenings.
Mm-hmm. You have a son of your own, and you mentioned him, at the top of this,
mm-hmm.
and you've been involved in coaching him and his teams. What has that experience been like for you, and how has that affected, maybe how you want to train kids?
It was kind of eye-opening initially. I'm not going to lie, just coaching my own son and watching him learn and develop and ask questions and dealing, especially at the younger age, because they really look at you for guidance. And managing him and on the other kids on his team was a lot of fun. It made me actually go back and look at what we've done in the past and maybe to continue to expand on what we're continuing to learn. But every child, every kid is different. It's not a cookie cutter system. It never is. So with my son, because he's a swimmer, he plays football, there's a lot there, and he's developing really well, and he's moving really well, and we continue to have a lot of fun with this. We'll see where it goes. Hopefully a future Olympian. We'll see what happens.
So you screen all your clients regardless of age.
Yes.
At some point in the future, we'll do a deeper dive in this, but can you briefly tell us about the screening process? Like, you don't just take somebody who walks in the gym and start, throwing them into exercises.
No, again, everything's basically on goals. And we see people, not just athletes, we see people that want to lose weight or that are coming from physical therapy that are, want to get, so they've hurt their shoulder and they want to get back on the basketball court and start shooting hoops. We work on creating strength and stability through the FMS first. We do the screening, talk to the clinicians, and then based on what they show us, we create corrective strategies, training strategies for them to get to those goals, because everybody's goal is different. It's not the same. There's a lot of carryover for sure for a lot of people. And honestly, Mark, there's some people that just want to kind of just check the box. They, one of my clients is one of her goals is I want to be able to get up and down off the ground and play with my grandchildren. What a great goal. And that's absolutely fine. That's basically the premise of what we do. Everything has to based on a goal. And with the kids, it's about just being able to perform or outperform the competition. So whatever the screen shows us is basically our hierarchy on how we approach to get them to where they need to be.
Mm-hmm. One thing that I've seen quite a bit over the years, when I've gone to different places is, how should I say this? Trainers who want to train kids as if they're adults. And that's not the best idea.
No, it's not. That's where there's a lot of bad information out there. And it's not so much the trainers themselves, it's the lack of knowledge. And you have to be really careful depending on what their age is, if developing and put it, because there's developmental issues that you have to be careful with weight training, performance style training. It really depends on the age, the screening, and what their goals are. And those 3 criteria have to be looked at first.
So I train with Vic at his gym. It's been one of the best things I've ever done with myself. So I can confidently say I look forward to more talks with Vic on a variety of topics, and we're all going to learn a lot. So it's going to be a lot of fun, man. Thanks for coming on with me, and we'll do this again.
Yes, thanks, Mark. Appreciate you having me on.
All right. Don't be a meathead, man.
Try not to.
All right. See ya.
See ya.